beautiful people. We have a very interesting person today called Dr. Patki. Dr. Patki, why don't you tell them, my audience, what really do you do? Because first of all, even before I begin, I must say thank you to him, because this is a very big opportunity to know what everything is about from a doctor's point of view. So doctor, could you just tell us what is your specialization and what you really do?
For me, people, I'm Dr. Amit Patki. I'm trained as a gynecologist and an obstetrician with special interest in infertility practice. If I have to give some information about myself, I would say that I'm born and brought up in Mumbai. I did my graduation from the Sion Hospital, Lokmanya Tilak Hospital, my undergraduation and my post-graduation. And after a short stint as a lecturer in Nauroji Wadia Hospital, maternity hospital, which is the biggest maternity hospital in Mumbai, I had a wonderful opportunity to work and train in London.
Wow.
I did my exams and qualified as an obstetrician and gynecologist in London, and then I had this unique postdoctoral fellowship for 3 years in which I trained in practice of infertility and reproductive medicine. Although I was doing exceptionally well and had a wonderful opportunity to actually settle down in London and become a consultant in a leading hospital, I chose, my mind ruled over my heart, and I decided to come back to India and be amongst our people and work in Mumbai.
Wow, what wonderful thing to say.
I worked in 2 best infertility centers in Mumbai and had the opportunity to head the Reliance Life Science as the medical director for infertility, endoscopy and fetal medicine for a period of almost 8 years.
Wow.
And then the entrepreneur in me got in, and then I decided to start my own IVF center, in which we are here for and which I am heading now, called as Fertility Associates, for the last 4 years.
Wow.
I've had a wonderful journey both in Mumbai and abroad. And I think what I learned in UK was not the medical science of infertility, but the art of managing infertile couples. I learned more about communication skills, how to respect and value your patients.
So Dr. Patki, you were talking about, amazing journey that you've been through. And you said that you learned the art of managing the couples who did not have children. And that, I think, is such a beautiful thing that you've learned. And I've myself experienced, whenever I've met you, that humbleness and beautifulness. What really inspired you to get into this kind of a field? Because it's not easy. Like you said, we got to manage people. And it's not just managing an illness, it's managing people. So how did you go about that?
True. To be very honest, when I went to London, I went with a very open mind of learning more of obstetrics and gynecology. But having been there for 2 years, I realized that the management of infertile couples was always very incomplete and very abstract, even in a developed country like the United Kingdom. I worked with very dedicated and passionate professors, and I was slowly enthralled by how they manage these infertile couples, because often infertility is not always some medical illness and disease. It is quite often related to our stress in life. It is related to your interpersonal relationships. It's related to how busy the couple is, which I am now seeing in our own country. And I used to think that these are very unique people, and because maybe it's a European country, their problems are theirs, and maybe I will not face such problems when I come back home. But I have seen that it is now happening even in our countries.
Wow.
The stress that people go through, I mean, the average couple travels at least an hour each way to work. An average couple in the city of Mumbai works for at least 8 to 10 hours.
Yes.
And quite often the first question I ask couples nowadays is, do you have time for sex? Because that is something I find is the most common cause for infertility in our couples. With the advent of internet and broadbands and WhatsApp and Facebook, people are spending less time with another live human being. They're spending time on their own. They have friends, but these are all virtual friends. And I often find that there are so many other so-called attractions which are happening that quite often sex takes a backseat in quite a few couples' lives.
So is it that these couples, when we're talking about the sex takes backseat, is it really that, because if people want to make time, they make time?
True, but having said that, you can imagine somebody who gets up at 5, has to catch a local at 7, reach the office at 9, and doesn't come home till 8 o'clock in the evening.
Right.
Where is the energy and the interest left? You are tired, hungry, sweaty, you just want to eat, go off to sleep.
Absolutely.
And the next day starts again. And without you realizing, then you realize that yes, sex happens only on the weekends. Sex happens only when you feel now you want to have a baby. It is not for the pleasure of sex, or when the doctor advises you to have sex. So quite often I see couples who now work different shifts. You have the husband working in a call center and you have the wife working in a routine 9 to 5. Even if you have the interest, even if you have the time, your times don't match to each other. There are so many executives who are traveling 10 to 12 days of the month out of home.
Absolutely.
So these are things which were not happening 20 years back.
Absolutely.
And these have added on to the problems of infertility.
That's so interesting that you say this, because a lot of us believe that infertility is just something that can be sorted out by going to the doctor.
True, and that is another problem, because now people read of somebody having a baby at the age of 50 and 60s. They feel it is possible for every couple to have that, and they push it to very late because of career goals, to start off with late marriage, then career goals. And quite often even women now are competitive and are competing for big positions. So they find that the childbearing, pregnancy, looking after the child is going to be a hindrance to their job.
Right.
And they push it to so late that then they need medical assistance.
Absolutely.
And I, as a doctor, I often tell people that it is not just having a child. You have to be fit for the next 20 years, physically, mentally and financially, to look after the child, because that is what is parenting, and that is why you wanted to have the child in the first place.
Absolutely. Guys, if you want to really connect to Dr. Bhatki, let's ask him where and what is his number, because he's given us such great tip. So understand that, if you don't connect, if you don't communicate, if you don't take out time for yourself, the problem is going to exist. Let's not make sex as a medicine. Let's have pleasure with it. Yeah. So let Dr. Bhatki tell how do you connect with Dr. Bhatki?
My cell number is 98201 32585. You can also connect on fertilityassociates.in.
Thank you so much, Dr. Bhatki. If you want to connect to me, Anu Mehta, do go on my blog, anumehta.co.in. Thank you very much for listening. Catch you back again.